This podcast is on personal growth index, or PGI. It's a concept created by a colleague of mine out of Brazil who does long-haired hair transplants. And essentially what that is taking long hair grafts, transplanting them. He does a strip procedure, and then watches those grow. His argument is that by having long hairs, the patient's able to be excited about a preview, and by seeing that hair, gets excited about the results. To me, sometimes I've done this, and the only concern I have is those grafts are very fragile. They're very easy to fall out if they're not secured well, and they give sometimes a false impression to the final result because the discoloration that's on the scalp makes it look even denser than the actual final result. Well, that all being said, I think what he's done is an incredible genius idea of measuring what is the percentage of survival, the question of the hour when you're looking at survivability with grafted hair. So the personal growth index, essentially what that is first of all, let me tell you what he did. He first of all took what's called a hair mass index, where you actually group a group of hairs, and based on the mass of that hair, you can just sort of distinguish or determine a certain number. So he took this group of hairs measured at the end of the procedure, since remember they're long hairs. Then at a year later, he was able to remeasure that hair mass index in the same area of the scalp and find out what percent of hairs actually grew. So he actually had a hard number on that. And what he found very interesting is several things. First of all, he found that different people by the same surgeon, that is him, so offering the same quality, had different percentages of growth. For example, someone may grow at 85% and someone may grow at 97%. What he found was that those patients that came back and did a second surgery with him, they found that the same person that grew 85% would grow 85% the second time, more or less. And the person that grew 98% would grow 98% the second time. Hence the term personal growth index, or PGI, meaning the percentage growth of that person. Now, what's interesting is prior to 2011, when this concept was formulated, I really subscribed to that and told a lot of patients about the limitations of growth survival if their anatomy was not as perfect as possible. Now, today still, if someone's diabetic with bad vascularity, they've had huge sun damage, they've had maybe cancer, radiation, whatever those things, I can tell you that still survival could be less. But what's very interesting is if you look at my website, even under scar repairs, you can see these patients that have had skin grafts, cancer, where you think that the graft survival would be actually poor and inadequate, still do very well. So why is this concept, in my opinion, not outdated, but I would say slightly outdated, given what has happened in the last 10 years from 2011? I'm doing this podcast now in 2021. To me, what has changed is simply that I've been using regenerative medicine, PRP, ACell, ATP hypothermosol. More than happy for you to go and listen to the podcast on these concepts, because they take a whole podcast to talk about each one of them. But the easiest way to think about them is that they're fertilizers. They're like if you put a flower into a piece of some dirt and you let that flower grow better, the flower grows better because the dirt has been fertilized. And these fertilizers, regenerative medicines, to me, have blown out the idea of PGI. Now, why is that? Back in 2011, as I started to do the first half of placing regenerative medicine into my surgical transplants, that is PRP and ACell, I noticed that my patients had come back initially with average growth. It wasn't that great, wasn't spectacular. And I did the second session with them at that transition point with PRP and ACell, and it was insane. The growth survival was great. And if I look at my surgeries prior to 2011 and after 2011, I rarely, if ever, see now a case where it's really poorly grown. Now, it can happen, but it's pretty uncommon. Whereas prior to 2011, it wasn't that common, but it was definitely much more common. And now that I saw those same patients that I went through and did the regenerative techniques, I found that their growth has been exceptionally better after 2011. If anything, if you think about the concept that if vascularity and everything is a problem and they're getting older and older, they actually should maybe not take as well, but they're taking so much better. And I think the reason why the concept of PGI now is slightly outdated is that and of course, as I said, there's always limitations based on your own anatomy. But because I have these amazing regenerative fertilizers that can help with survival of the grafts, I believe that the term PGI may be slightly outdated in my opinion today.